Hey guys, we're going to be doing a wet to dry dressing, so I'm going to show you a little bit on how it's done. I'm sure a lot of you know how it is, but for those that it's their first time doing their dressing, I can show you a little bit of tricks on how to be uh, less in pain when you're kind of removing it and changing and applying the new dressing on, and what's the right way of applying it. Obviously, you want to make sure it's healing properly and the dressing is put in place properly. And what are the signs that it's healing right? And once you take the dressing off, what you should not be scared of and what you should be expecting. All right, guys, so here it is. So these will be the items that you would sort of need. You got the 4x4 gauzes. They actually come two in a pack, so you would kind of need, depending on how big the wound is, whether you need one pack or two packs or three packs. Um, so obviously you need the sterile ones. Everything has to be sterile, and just make sure everything's packed out right. Pair of gloves. You got the wound flush saline. Um, After washing your hands, you obviously got to use the sanitizer and then put your gloves on. Make sure you got this sheet, so everything is sterile, scissors and tape and tweezers. Obviously, tweezers is important. Sometimes you can't just pull the dressing off, so it kind of helps you sort of pick it out slowly by slowly so it doesn't hurt as much. And the abdominal pad. This is smaller for smaller wounds. There's bigger ones, obviously, for bigger wounds. And the cling right there, which we're going to be wrapping it around once we're done with everything. So what I kind of do is I put the saline in hot water. Obviously, it's closed bottle. So you're going to use, obviously, the saline right here. And you got this syringe right here. So what I use the syringe for, it's a big fat syringe to obviously pull the saline off of it. So you got this saline bottle. Normally what happens is it hurts me to use cold water or cold saline. So I kind of warm it up, and it still does sting, obviously, because you got sodium chloride and all of that. So I fill it up in the syringe. I use it on the dressing that is kind of stuck to the wound, and hopefully it helps it release by itself instead of me pulling and tugging on it. So what you're going to do is you're going to take these gauzes right here. You're going to open them up and just make sure everything is not sort of touched in the beginning, because obviously we're just going to be taking the dressing off at first. And we want to make sure everything is open, laid out properly, so it's easy to access. So these are all the items that obviously we're going to be using. So as I was saying, the wound flush, I kind of not use it on the wound because of the pressure that it has, and obviously you don't want anything stinging or hurting or coming with that kind of pressure on the wound. And that's the reason I kind of use the syringe, to make it all easy for me. So you got the hot water with the saline in it, and then you got the empty tub where you're going to be throwing out all your old pads and dressings in. Alright, so this is ready. What we're going to do is we're going to be putting the saline in, damping it, and I'll show you the next step once we're done taking the dressing off. Okay, I'm ready. So this is the little bottle with the syringe that you're going to be filling up with saline. Here's the syringe that you're going to be using. It's obviously pretty big, so you just kind of fill it up. So what we're going to do is we're going to start cutting the dressing off. Hopefully you guys get to see exactly what I'm doing here. It's not that easy to make the video while holding and doing all this. So just make sure, obviously, you have the gloves on. At first stage, you wash your hands, you use the sanitizer, make sure everything's sterile as much as possible. Then put the gloves on, take the dressing off, and then after taking the dressing off, then you're going to change your gloves once more. Use a sanitizer to make sure that the new dressing that you're going to be applying, there's no germs to it. Okay. All right, so this is sort of the wet one that I put on the top, but I guess this is stuck to the skin as well. So we're gonna apply the saline right now, and hopefully just let it fall off by itself. Yeah, in the corner right there. So as you see, I'm not pulling it. I'm just waiting for it to fall off, which it kind of just gives up on its own once it's wet enough. Okay. There you go. So what I normally get done is I put the saline with the syringe on the fresh skin instead of the inside skin, so it doesn't sting. It kind of just sort of glides onto the dressing from there instead of just literally squirting it right on the wound itself, which hurts. Okay. It is time consuming, obviously, because everything is stuck and you want to make sure you take it out as softly as possible. So you'll see after a while, it just sort of starts falling on its own. Okay, so at this point what I'm going to do is, I was telling you guys about the tweezer, so here's the tweezer. Sort of. It's stuck very firmly. Okay, it's heavy enough. See, it's kind of pulling on its own. Alright, grab this from under, no, the band-aid. So if you see, it's disgusting, but there's some yellowy stuff. These are the white cells, obviously trying to fight itself to get in there to heal the wound. All right. If it looks pinkish and you see it's all clean and it's not bleeding very badly, which is a good sign. Um, Everything looks good. Everything looks fine. There's not a lot of pus in there. I mean, you'll see a little bit of pus here and there, obviously, because as I said, the wound's trying to heal itself. But otherwise, there's no activity of infection going on in there, and you could see it's pretty clear. Although the video is a bit dark, but all right. So what we're gonna do is we're gonna change the gloves. Okay, so we're gonna take the 4x4 out. I told you there's 2 of them in there, so that's one, and then obviously you got the other one right there in the bottom. So what we're gonna do is we're gonna kind of squeeze a little bit of water out of it and then open it up. So you want to make sure it's not too wet, and you want to make sure it's not completely dry either. That's the whole point of wet to dry. So there you go. You kind of open up, make sure each and every string is open, and you kind of just put it all together, fold it up nicely. And obviously, as big as the wound is as big as you would want to make it. Okay. Okay. So here's the dressing. I'm just gonna go ahead and sort of put it right in there. There you go. And as I was telling you, you just want to make sure everything is inside the wound. Anything, all the wet dressing should be inside. Nothing should be touching outside the skin. So as you can see, it's like sort of folded, all molded into the wound. And then you take the second wet one and sort of just open it up, not too much, just one layer of it, and kind of fold it same way, and just reapply it on top so it just keeps it a little moist, so the other one doesn't dry off fairly quickly. And kind of just boom, apply it right on there, and then you just kind of just follow the protocol. You got the dry 2x4, 4x4 gauzes. Put them on, and you got the ABD pad, obviously. So, okay, now I'll just open it up right there. Okay, now with this area, obviously, the problem is that when you try to wrap it up, we're gonna run into problems because it's not tight enough, or you gotta go over with at least 2 of these band-aids to kind of secure it. So I'm gonna go and tie it up. There, and that pretty much secures it. And oh, the pressure is what kills it. Obviously, you got the area it's in. Obviously, we're gonna have to use 2 of them, so I don't want to take too much of the video time. But that's pretty much it. You apply the tape on, and that's about it, guys. Hopefully, it have helped some or will help some. Just let me know how things work out. Have a good one.